Hello, my name is Crystal, and today we'll be doing an assessment of the lung and thorax. This is my patient. Do you give me permission to record this video, upload it to YouTube for my professor to review and grade?
Yes.
She verbalized yes. I've done all necessary precautions. My patient is safe. I've washed my hands. She is seated comfortably. I've provided privacy and verified HIPAA. So we're going to start our assessment by inspecting the chest. What we're looking with chest inspection is any trauma, any use of accessory muscles when the patient is breathing. We're also looking for her respirations. We're looking to see if there's that symmetry of movement when she breathes in and she breathes out. We're inspecting and looking for the AP ratio. We're looking to see if there's any retractions. From there, we're going to go ahead and we are going to inspect her nails. So we're going to take a look at her nails. We're looking for any cyanosis or any clubbing that may indicate any problems with her lungs. And we don't see any. We're looking again, to see that purplish or that bluish color on her nails, which we don't see, and that would be considered normal. From there, we're going to go ahead and we're going to look for the respiratory excursion in the anterior part of her chest, and then we're going to go ahead later on and move to the posterior part. So I'm going to go ahead and I'm going to ask my patient, we're going to place our hands here bilaterally, and we're going to ask our patient to take a deep breath in and out. And what we're looking for is that symmetry, that movement when she breathes in and she breathes out, which is what we got when she took her breath and would be considered normal. From there, we're going to go ahead and check for tactile fremitus. What we're looking for is that vibration. I'm going to have my patient, we're going to start right here below her clavicle, and I'm going to ask my patient to say 99.
99. 99. 99. 99. 99.
And what we're looking for is that vibration every time she says 99. If we don't hear that vibration, that could indicate there's some type of fluid in the lungs, any type of edema, any swelling of her lungs. So we want that vibration when our patient says 99. From there, we're going to go ahead and just palpate her mid sternal border just for any pain. Let me know if you have any pain. Okay, so with the palpation, we're just looking to see if the patient is experiencing any pain, which may indicate any trauma to the rib cage, any trauma to the lung. And she verbalized there is no pain. There shouldn't be no pain when we palpate our patient's chest. From there, we're going to go ahead and we're going to percuss. With percussion, we're looking for that resonance, that sound. If we don't hear that resonance, that can indicate there could be some type, again, some fluid in the lung, some edema, something going on that is not normal. So we're going to percuss by tapping on the distal joint of our non-dominant hand. And I'm gonna go ahead and start my percussion. And we want to compare the sounds from one side of the lungs to the other side. And again, we want to hear the resonant sound, which is what would be considered normal. If we hear that dullness, then that can indicate that there's some type of fluid in the lungs. From there, we're going to go ahead and we are going to check for, in the posterior part, we're going to listen to the lung sounds. So we're going to auscultate the left side and the right side of the lungs. And we're looking to see if we can hear any stridors, any crackles, any adventitious lung sounds, any rhonchi. So we're going to go ahead and we're going to listen. In the front, we have 6 positions that we listen to. So we start around between the first and second intercostal space, right below the clavicles. And I like to do it like in a ladder pattern. That way I'm able to compare. And then we move to the sides. Okay. That will conclude our assessment in the anterior part. Now we're gonna go ahead and we're gonna move to the posterior part of the lung, of the assessment. Okay, so here again we're gonna do the same. We're gonna inspect our patient's back. We are looking, let me move the camera a little bit more. We are looking for her respiration. We can see her breathing. We're looking to see if there's any trauma, if there is any abnormalities, if there is no symmetry with her breathing. From there, we're going to go ahead and we are going to palpate. I'm going to ask my patient to say 99.
99, 99, 99, 99, 99.
Same thing, we're looking for that sound, that vibration, which means that there's air moving through and it's normal. That's what we want. Now I'm going to check for the lung excursion. I'm going to have my patient go ahead and take a deep breath in and out. And what we're looking for is when we have that placement like this, what we're looking for is for that chest expansion when our patient is breathing. Now we're going to go ahead and we're going to look for the diaphragmatic excursion. With that, what we're going to do is I'm going to go ahead and I'm going to percuss my patient's posterior back of her thorax. I'm going to percuss. And when I find that switch from resonance to dullness, I'm going to mark it and then I'm going to continue percussing. So we're going to go ahead and we're going to start with the percussion. Okay, so now we're going to go ahead and we're going to check, like I said, for the diaphragmatic excursion. So what we're looking for here is the change from resonance to dullness. Okay, here it is. It changed to dull. Now I'm going to ask my patient to take a deep breath, inhale in and out, and to hold it. And I'm going to percuss up. And I'm looking for that dull to resonance again. And here it is. And I would mark it. You could continue breathing normally. And I would mark it bilaterally. And that should be between 3.5 to 5.5. From there, we're going to go ahead and we're going to listen to the lung sounds. In the back, like I said, we have 7 positions that we listen to the lung sounds. Okay. And again, we're looking for any adventitious lung sounds, any wheezing, any stridors, any crackles, any rails, anything that's abnormal. From there, we're going to go ahead and we're going to do a specialty test. We're going to do the bronchopnea test. I'm going to auscultate when my patient says 99. And again, we're looking for that vibration in the sound. We're looking to hear and make sure that there is no pneumonia. There's no fluid in the lungs. There's no edema. Say 99 for me every time I place the stethoscope. And again, I would be doing this under her clothing.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. I've already inspected my patient's posterior part of her thorax. I auscultated her breath sounds. I palpated for tactile firmness, and I also did my specialty test. This concludes my lung and thorax assessment. I hope you enjoyed watching, and we will see you again next week.